I do believe that we further need to improve our policies against tobacco use. And we have to be very ambitious when the revision of the current directive will be on the table of the Parliament, and I'm sure it will happen during this legislature. And for that, my intention is to propose to my colleagues from European parliaments, not only from Environment and Health Committee, but also from other committees, together with relevant stakeholders outside from the Parliament, to build a working group in order to prepare this revision of the directive. We need more efficient legislative against tobacco use, and we need to unify our forces in order to achieve one day a tobacco-free environment and society in the European Union.
First, thank you very much for organizing this event. It's very timely. You want to present your results. We are at the start of a new commission, so it's a very good opportunity. And I would also like to thank you from the Parliament for being a champion in tobacco control. We need a strong Parliament in tobacco control activity. So where do we stand in tobacco control? So we have about 700,000 premature deaths in the EU every year, which is an equivalent of the whole population of Sevilla, for example. These are not grapes, this is this little thing, the little picture, this is the population of Sevilla. We have about a quarter of the EU population that is still smoking, a little bit more, and that is a rather stable rate that we have since 2014. We are seeing a slight increase in youth smoking rates. It depends a little bit on the countries, but overall a slight increase. Let's not forget that tobacco is due to several cancers, the most important of which is lung cancer, and about 1 of 5 cancers in the EU are due to smoking. So if you want to prevent that, and we are here in the prevention business, you can really cut out 1 of 5 sick people, cancer people, by really doing a strong tobacco control work. So what we try to do at EU level is what we can do at EU level under the competencies that we've got. So first, we want to achieve a high level of health protection in the single market. So we are based on the single market article. We have a focus on young people, because this is where the next generation comes in. Once you are addicted, it's much more difficult to get rid of this addiction, so it's easier to try to prevent the young people from taking up bad habits. We are protecting citizens from second-hand smoke, not under EU law, but under a council recommendation, because the laws as such are national competence, so this is done by member states. We are trying to reduce the consumption of tobacco by 2% within 5 years through the Tobacco Products Directives. This is not extremely ambitious. It's a certain step that we are doing there. We try to implement the provisions of the Framework Convention on Tobacco Control, and what we have discontinued was we were also in smoking cessation with a campaign to help current smokers quit. This was cut because we think this is also, so first this is mostly national competence, and this also needs to be tailored to national situations. What are the tools that we have at our disposal? It's legal tools, so we have 2 main laws that regulate tobacco, and it's the Tobacco Products Directive, it's the Tobacco Advertising Directive. We have then from DG TackSHS, managed by DG TackSHS, the Tobacco Taxation Directives. We have activities against illicit trade. And did I mention tobacco advertising? Yes, I mentioned it, tobacco advertising. We have political tools This we use normally if we cannot legislate at EU level ourselves, but if member states do this, so we have, for example, a recommendation on smoke-free environments. I'll come back to that. We have financial tools, so we can give member states money to act in tobacco control. For example, we've set up a joint action on tobacco control in end of 2017, which runs for 3 years, to look to help member states to implement the Tobacco Products Directive, and we have international activities. So law in tobacco regulation, law in advertising, promotion and sponsorship, where we have if it's cross-border, then on the right-hand side the tax measures and illicit trade and the smoke-free environments recommendation. So this is the main piece is the Tobacco Products Directive from 2014, which had to be to start operating in 2016. It has the big piece is the pictorial warnings that you see on the bottom, which are new since then. You see the little track and trace box on the top. So we have set up a track and trace system for the tobacco products, and the legal base for this is in the Tobacco Products Directive. We are also looking at ingredients for tobacco products as well as for electronic cigarettes, and we are looking at, or the directive has provisions on electronic cigarettes because they have recently been in the limelight. Electronic cigarettes are not safe products, and in great wisdom, when this TPD was regulated, it contains rather strong provisions already on electronic cigarettes. So that was a real wisdom from the co-legislators to take that. As challenges of the implementation of the TPD, it is a big piece of legislation, and I always say it's like a Bible. Every time I look into it, I find something new. There are also provisions that need to be interpreted. There are 15 implementing acts around this directive, and since 2016 we've been working through setting up these implementing acts, and for example, track and trace was a piece of them, the pictorial library was a piece of them, everything that we are doing on characterizing flavors is enshrined in implementing provisions, and we are working on them. So the big implementing directive, it's not just the text of the directive. We had to find legal challenges at the courts, as with every piece of legislation that we have. We had won several cases already, there are still some ongoing. We have new products emerging, especially novel tobacco products, heated tobacco products, developments in electronic cigarettes. These are challenges. This is where the future tobacco control efforts will also have to be. It is not just about cigarettes or water pipes. It is really also around novel products and what they mean for health. And then, the illicit trade, that was also a major piece, the track and trace system. Then I would just like to point out, in order to help member states to implement this rather complex directive, we set up a joint action on tobacco control. It looks mainly at product evaluation, ingredients evaluation of electronic cigarettes. It looks at priority additives, and it looks at laboratory cooperation. We have 31 member states, 31 countries, out of which 25 member states, for 3 years, and a budget of about 2.5 million euros, with 2 million coming from the EU budget. So this is to help member states implement the TPD. Then we have what was in the limelight recently in May this year was the setting up of the track and trace system. I said the legal base for it is in the TPD, and it translates provisions from the protocol on illicit trade on tobacco products under the FCTC into EU law, more or less. Then we have an older piece of legislation. It's cross-border tobacco advertising, promotion and sponsorship. That directive is from 2003. And then we also have the audiovisual media directives that has certain other elements and bans on advertising, promotion and sponsorship, and the tobacco products directive that bans advertising, promotion and sponsorship for e-cigarettes. This is framework which is being challenged again because we see a lot of indirect advertising coming up. For example, in the last Formula One races this season, it started in some states. We saw things that one could consider indirect advertising. So the direct advertising, the Marlboro sign has gone out, but this is something that we are monitoring, and then we've also asked the member states to look very closely at what is happening on social media, on what is happening on advertising on new products in their feeds. And there, the line between direct and indirect advertising is getting blurred, so this is something we need to look at. Next slide, please. Then I come to the Council recommendation on smoke-free environments. It's from 2009. At the time, it followed a Commission report on smoke-free environments. And what it basically does is translate guidelines of the Framework Convention on Tobacco Control that also looks at smoke-free environments into an EU context. We already had a study in 2013 that looked at how member states implemented it. We made considerable progress, but there are also loopholes. For example, what are we doing with e-cigarettes? And so here this project comes in at a very timely moment, and not all of the laws that we have in place cover all of the hospitality sector. Sometimes we are seeing rollbacks in some member states, and we monitor that very closely. Then only one piece for the Framework Convention on Tobacco Control, international treaty. We are extremely active in this treaty because we think it's also important for us, not just also for the rest of the world, but it helps also us to push certain things forward. For example, at the last conference of the parties, we were active on novel and emerging tobacco products, on Article 9 and 10, that is ingredients and disclosure of information, and the working group on Article 13, that's advertising, promotion and sponsorship, to look at these blurred areas. Next slide, and I'm nearly finished. So what are the next steps? So the next big thing that will come up from the Commission is the implementation report on the Tobacco Products Directive. According to the directive, it is due in May 2021. And this will be a milestone for the discussion on what the future, what future direction we will take. We are also still very occupied with the track and trace system so that it runs smoothly. We are looking very closely at the e-cigarettes now for the time being after the hype that we have. So far we did not have notifications from member states on similar cases. But it doesn't mean they don't have them, but they haven't reported them so far. So let's see how that evolves. We are active on smoke-free environments, especially like monitoring what member states do. We are also helping member states when they ask us for how is it go, what's the situation in other member states. We have a good overview. We monitor cross-border advertising, promotion and sponsorship. In taxation, there is an evaluation ongoing. I don't know by when the Commission will come with an updated proposal. or with a proposal to change the directive. We are not chef de file for that, but the taxation strategy, the taxation is something to look at and watch out for, because it's one of the most efficient tobacco control instruments that we have. Then under the plastic strategy, the cigarette butts were addressed. It's more in the environment field, but now companies have to set up extended producer responsibility schemes for cigarette butts. So that is an ongoing activity. We will, at the next COP in the next year, we will be very active again. And as you all know, the Commission is working on a future cancer action plan. And we think that in the prevention part, tobacco control will be a very important component.
Thank you very much. Thank you for this very comprehensive and very clear overview on what has been done until now and what are the challenges ahead. Many of these challenges will be, I think, addressed in the next interventions. And now I go to the President of European Network for Smoking and Tobacco Prevention, to Dr. Francisco Rodriguez, and I give you the floor.
Good morning, ladies and gentlemen, members of the European Parliament, representatives of the European Commission, dear colleagues and friends. Welcome to you all this morning to this session, which aims at providing us with the final results of this ambitious European research project involving 12 partners from 6 countries that for the past 48 months, Professor Estela Fernandez has been tirelessly coordinating this project and the numerous research teams with great energy, passion and efficiency. The scientific findings of the TackSHS project could not have come at a better time, when so much controversy is happening right now around us regarding e-cigarettes. As of 1st October 2019, according to the latest figures from the CDC, more than 1,000 people have shown to suffer from a lung injury outbreak in the United States, directly associated to vaping, among which 90 people have died. Very little is known about these new products, that some in the tobacco control community, in our community, are using as smoking cessation devices or harm reduction tools. A message that has also been opportunistically rehearsed by the tobacco companies themselves to market their novel products. With the increased number of casualties from e-cigarettes, and unfortunately, I am certain that we have not yet seen the end of this growing pandemic. 884,000 people worldwide still die every year from second-hand smoke. Article 8 of the WHO Framework Convention on Tobacco Control requests all parties to adopt and implement measures to protect their citizens from exposure to tobacco smoke in indoor places, workplaces, public transport, and other places. However, further actions are very much needed from governments regarding the harmful effects of second-hand smoke in private homes, as well as the risks caused by e-cigarette aerosols. While our work has been focused on preventing young people from starting smoking and supporting smokers to quit, the European Network for Smoking Prevention, ESP, for which I am the proud president, remains at the forefront of supporting advocacy efforts, including preventing any generation of Europeans from becoming addicted to nicotine and developing e-cigarette-related illnesses, putting an additional burden on health systems across Europe. To do so, the Tobacco Control Committee needs to rely on scientific evidence to enable policymakers and legislators to adopt clear, effective and strong policies. I fully believe that TackSHS research findings will definitively improve our understanding of second-hand tobacco smoke, as well as the health effects of e-cigarette emissions, and with that find ways of tackling the health burden caused by exposure to them. The more data we collect, and the stronger we are to fight the tobacco industry, which at the moment is using confusing messages to push for harm reduction or less harmful products, especially towards our children and young people. I seriously hope that TackSHS will generate further research at European levels in order to understand the real links between second-hand smoke and e-cigarettes emissions and lung disease, so that policies can be adopted to better protect the health of our citizens and future generations. As the first cases of e-cigarettes-related illness are appearing in a number of EU member states, I would like to call on the European Commission and members of the Parliament to seriously consider collecting and funding further research, such as TackSHS, to ensure that we understand the real harm of second-hand smoke and e-cigarette aerosols, and therefore protect EU populations with the most comprehensive legislative measures. Because when it comes to the health of our citizens and the health of our children, dear members of the European Parliament, dear representatives of the Commission, we should never leave any room to any kind of harm whatsoever. Thank you.
So thank you very much to all of you for being here, and let's have a quick overview of the main aims of the project. The TackSHS project is aimed to provide scientific evidence on exposure to secondhand smoke, and also which is the burden caused by this exposure and which is the real situation now in Europe. We want to address not only secondhand smoke exposure, but also at the moment when we started the project, almost 5 years ago, the emerging problem of electronic cigarettes and the passive exposure to the aerosols from these devices, exhaled by users from these devices. So this is it has been a 4-year research project that comes to an end now at the end of October, involving 11 institutions from 6 different European countries and also other countries in which part of the studies have been conducted. We have almost spent 3 million euros from the European Commission for this purpose, so the responsibility to do the things all right was high, and the results are becoming now available. Our plan is to present here an advance of the results and of course to produce the scientific papers that will help also to drive some policy decisions, hopefully in the future. The TackSHS consortium is formed by 11 institutions from 6 countries, as I have mentioned, putting together different groups with expertise in secondhand smoke, in tobacco control, and also in the emerging field of electronic cigarettes. We also have other countries implicated in the project, in which part of the studies have been done, because we have 2 main, as I will present, 2 main studies with field work in 12 countries in the European Union, plus also 1 study in Czechia. So the framework of the TackSHS project is based on 2 main studies. The first one is an environmental assessment of secondhand smoke exposure using environmental markers, and the other one is a pan-European survey in 12 countries, interviewing representative samples of the adult population to gather information on smoking, secondhand tobacco smoke, and electronic cigarettes. In the first study, involving 11 countries, what we have done is to measure nicotine in air in different public places, mainly those not covered by the current legislation and diverse legislation between the countries. So we have done measurements in school entrances, in children's playgrounds, also in homes and cars, and also in terraces of hospitality venues, of bars and restaurants and so on. The second study, the survey, has been conducted in 12 European countries, including 1,000 people, adult people in each of the countries, representative of the population, to gather information on smoking, detailed information, as detailed as perhaps other surveys currently implemented, but in addition with detailed information on secondhand smoke exposure and also in electronic cigarette use and the perceptions about exposure to the aerosols of electronic cigarettes by the non-user population, and also of course about attitudes and knowledge from the population towards tobacco, the harms of tobacco, electronic cigarettes, and the potential harms of electronic cigarettes. In the third study, what we have done is to test an intervention addressed to have smoke-free homes, because this is another of the key components. So it's not only to measure whether there is exposure, but to try to change the situation. So the team from Scotland designed, and we have implemented in 4 countries, an intervention in the private households to try to reduce smoke exposure through daily feedback of the air quality in their homes, through daily measurement and feedback through the internet. So this study has provided also interesting information that will be explained later. The other study in which we have studied not only the effects of secondhand smoke exposure in the population, well known, but among patients with lung chronic diseases such as asthma and chronic obstructive pulmonary disease. It is well known that secondhand smoke exposure affects the health of people, but very little was known about how these susceptible people with existing diseases also react to even low exposures of smoke in open areas, in places where it is allowed currently to smoke. So we have tried this, and also we are measuring in a comprehensive way with the data from the survey and using vital statistics from several countries the attributable morbidity and mortality to secondhand smoke exposure. So we have evaluated this attributable morbidity and mortality in children and in adults in the 28 European countries. From this data, we have been also, one of the objectives of this study was also to derive the economic consequences of exposure to secondhand smoke. So we wanted to evaluate which was the burden in terms of economic burden, DALYs and QALYs, using different scenarios through modeling of the exposure from the existing data. In addition, we also, in addition to these studies more centered in secondhand smoke exposure, we had a component on electronic cigarettes. So the first study on electronic cigarettes was about the exposure to the aerosols exhaled by the users by bystanders. And we did experiments in Greece about exposure to these aerosols in healthy volunteers to analyze the reaction, the physiology of the pulmonary capacity, and also several biomarkers of exposure to these aerosols. In addition to this, we also have tried to investigate which are the exposure to these aerosols in real-life conditions through 2 different types of studies. One, observational study, in which we have monitored households of electronic cigarette users living with non-users persons to try to assess both in air and with biological markers the exposure, and also we have done experiments mimicking real-life conditions in a small room and in cars. In addition to this, we have a methodological study in which we have tried to refine the way to make these measurements, both of secondhand smoke exposure, in which we have experience accumulated in the last years, but also in the new field of emissions from electronic cigarettes. We have done the calibration of the devices used. We have also evaluated new instruments to better measure all these exposures, and also trying to compare the different emissions from secondhand smoke, from the aerosols, and even lately in the project of other novel tobacco products. So finally, the only thing I have to do is to thank you very much, all the institutions, the research institutes, universities, and public health agencies that have been collaborating in this effort, because it has been a big effort that we started 5 years ago when we started to write the application, putting together our experience from several years working in other European projects together or in groups of some of the partners. So thank you very much to all these partners that have been collaborating fruitfully during 4 years, coming now to an end, and also with a new horizon, because our intention is to continue, even though the funding has ended, or will end in 1 month. Our intention is to continue working to provide the scientific audience with all the detailed results of our project, and also to try to provide this data for advocacy and to try to have some type of influence in the policymakers and the decisions to be taken from the European Commission, and also, if possible, at the national or even subnational level. Thank you very much to all of our partners in this adventure. Thank you.
Smoke exposure among non-smokers was 31%, as you mentioned, and it was highest in workplaces, 11%, homes, 13%, and in particular in other indoor places, including the hospitality sector, 15%.
So by hospitality sector, you mean bars or restaurants?
Restaurants.
And that's daily exposure. I mean, this is not occasional exposure. This is quite frequent.
Yes, this is daily exposure of to second-hand smoke.
Okay, interesting. I know the survey, from what Dr. Fernandez explained before, has provided detailed information about also the perception of harm from exposure to secondhand among the population. And we see now from this slide that the perception of harm is quite high in all the countries studied, and in the total in these countries were that 90% of the respondents perceive secondhand smoke as harmful to their health. And that's not surprising in a way, because secondhand smoke exposure really increases the risk of some diseases. Doesn't it, Professor Clancy, give us a little bit of your take on how it is the diseases that they create?
Well, as you say, it's accepted that secondhand smoke causes severe disease, in particular lung cancer, heart attacks, stroke, chronic bronchitis, COPD, and influences many other diseases. So that's been accepted for a long time. In fact, it was the basis on which Ireland was the first country in the world to insist that we get a workplace and pubs and restaurants and casinos. Countries have dealt with this differently. In Ireland, we say that you can have 4 walls as long as you have no roof, that you can have a roof, but you can only have 2 walls. So within this kind of restrictions, it has varied from country to country. So the idea in this project was to see what happens when people go into these areas that are legal.
And what happens?
What happens is that we picked people with disease, with chronic bronchitis and with asthma. And what happened was that they were exposed to very high levels, surprisingly high levels. We monitored the breathing of the patients with individual monitors, personal monitors of their exposure, which we're not aware was done before. We had done in these areas, and we have it in this project as well. This was personal monitoring, and we showed that these patients who thought they were safe were going to areas where we got levels as high as 2,000 2.5, 2,000 micrograms per cubic meter. And these are really high.
2,000?
2,000.
You're not wrong, it is 2,000?
No, I'm not wrong. It was not everywhere. It varied. But it was correlated with clearly the number of walls. If you had a space, an area with 4 walls, that's when the really high levels were found. But even with 1 wall, we found levels of greater than 250 microgram per cubic meter of particles.
So what is an acceptable, relative acceptable limit to compare with?
Well, there's WHO limits and there are European limits, and for instance, WHO would recommend no more than 10 micrograms per liter over a day. But these are shorter exposures, and Europe maybe 25, and we're talking about 2,000. So this is really a serious thing that these patients don't seem to have been told.
That's 200 times the level that is considered
Safe.
relatively safe, I would say, no? Yeah.
A compromise figure
Okay.
that is relatively safe. So these are really high exposures. And what we did then, and you can see them on the graph, this going up to 2,000. But you can see that there are many between 400 and 1,000. So this is a very significant level of exposure.
What do you have there with that beautiful abstract picture you have there? Can you explain a little bit what it is?
These are minute averages of exposure during their time within the legal smoking area. And they were in there, they stayed in for an hour, but we measured 15 minutes of it when they were at rest, because what we wanted to do was measure exposure, but also measure their breathing. So we looked at what happened to their breathing, and it varied, and it depended on the patient and the type of patient and the gender and the age and the size, etc. But in general, can be summarized to say that there was variation in breathing with all of these patients, not always in the same direction, but there was none of them uninfluenced by being exposed to this.
I think from the European survey that you've done, you have also produced some data on exposure levels to secondhand smoke that happens in other public places. Which are these places, Dr. Garbs?
Yes, for example, we had the information on second-hand smoke exposure in bars and restaurants, both indoor and outdoor. Actually, we asked non-smokers if they visited over the last 6 months a bar or restaurants, and among those who visited these restaurants over the last 6 months, 16% have seen a smoker smoking inside the bars and restaurants, and 71% have seen a smoker smoking outside, for we are talking about terraces of bars.
16 inside and 71 outside.
Exactly.
Oh, okay.
With some differences among countries, we can see them.
Would you like to add something, Dr. Fernandez?
Yeah, I wanted to add, well, this was one of the main concerns of the study, as I previously suggested, and then we did a force to characterize this exposure by means of markers, environmental markers, and this is part of what Dr. Maria Lopez has done in the survey, also in 11 countries, measuring environmental markers, nicotine, more precisely. What do you want? You want to add something, please?
Yes, well, we measure the second-hand smoke using nicotine air. The nicotine air is the marker of second-hand smoke, since it is specific. And we measure this nicotine using passive suckers that can be placed during several days, or that can be attached to an air pump, and that allows to do shorter measurements. That's what we did for outdoor settings. For instance, we measure more than 200 terraces of hospitality venues across the 11 countries of the study. And what we saw was that we found presence of nicotine in more than 90% of these terraces, in 94% of them. And also, it's, I think that's something very important to say, is that even in those countries with partial regulations that were banning smoking according to the type of enclosure, we found nicotine in most of them, showing that these partial regulations do not seem to work.
And by measuring nicotine, how specific is that real exposure to the second-hand tobacco smoke?
It's 100% specific. It means if we find nicotine, it comes from tobacco. That's different from other markers, like, I don't know, for example, particles that can come from other sources of combustion. If we find nicotine, it comes from tobacco exposure.
From what you told me, I really look at the figure you provide us that 94% of the 200 terraces had levels of nicotine. These are open areas or semi-enclosed?
In the terraces in the study has at least one wall or one roof. And what we saw was that the more walls, the higher the levels. But even if it was banned, these partial restrictions do not seem to work very well.
So we're not safe even in these areas that are...
No, I'm afraid you are not safe in those areas.
Okay, good to know. And how about, I think you also measure other open areas, or relatively open areas like playgrounds.
Yeah.
And is there legislation to protect children from secondhand smoke in these premises? What do you know?
Well, among the countries studied, in more than half of them there were regulations, but not in all of them. We measure the nicotine there, and actually we also collect data from the survey, right?
Yes.
So I think you have some data on that.
Yes, we found that 40% of Europeans have seen smokers smoking inside the playgrounds and the children playgrounds, and this proportion varied substantially among countries because it was less than 20% in Ireland, and it was more than 74, so almost 75% in Greece.
In Greece, it's quite high. Good. I think again your result doesn't cease to amaze me. So what is the attitude of European? Have you studied the attitude of European about legislation in these settings, Dr.
Yes, we had information on the attitudes towards these regulations in outdoor places, and we must admit that Europeans are favorable to a total smoking ban in some selected outdoor places. In particular, 40% of Europeans are favorable to a total smoking ban in outdoor terraces of bars and restaurants. 70% are favorable in children's playground, and 65% are favorable in outdoor areas of schools. Very interestingly, we found that also current smokers themselves understand the need of an extension of various bans. In fact, well, maybe not really for when talking about the outdoor terraces of bars and restaurants, but when we are talking about the settings that are devoted to children, also smokers were supported such ideas, such regulations.
Professor Cassi, you want to add something?
Well, just these results confirm what we found always. The politicians, and it's not harm we're in the parliament, have a notion that these things are unpopular. And in fact, every time it's surveyed, there is great support for...
Even smokers are supporting this.
Exactly, as Sumana has said, supporters, except in outside terraces. But they do realise that for playgrounds and public places, the reason they would not be so favourable to terraces, they were invented so that they could go there.
Yeah.
So that would be a more difficult issue, but it is important, I think, that people realise the very high levels that are in the playgrounds.
Yeah, indeed. I think the climate is certainly mature for further measures at country level.
The second-hand smoke exposure in cars, we found that 5% of non-smokers are daily exposed to second-hand smoke in cars, and 13% are daily exposed in homes. We can also observe that in Eastern Europe, the second-hand smoke exposure is higher, in particular in Bulgaria, Romania, but also in Poland and in Greece also.
Actually, we also measured the levels of nicotine in cars of smokers, and we found very high concentrations in these very small spaces. We found levels of nicotine that could be even more than 25 times higher than the levels of nicotine found in homes of smokers. Actually, in the study, we also measured what were the levels in homes of smokers, and we found presence of nicotine in 93% of these homes. And also, we found that these concentrations were more than 20 times higher in those homes without any smoke-free wall.
More than 70% of Europeans adopt a smoke-free home. I mean, a ban of a home smoking ban, more than 70%. And we found, however, major differences. In fact, this proportion ranged between 55% in Romania and 85% in England.
The TackSHS project included an interventional study, the assessment of an intervention designed by Professor Semple from Scotland and his team. With this intervention, we wanted to assess whether feedback on the air quality of the homes, in smokers' homes, can be beneficial to try to reduce smoking in these homes and to convert them in smoke-free homes. We used air monitors, air quality monitors, measuring at a daily and constant basis the concentrations of hazardous particles, PM2.5, that we know that they are harmful to health, and giving daily feedback to them through the internet, via SMS and also via email, about the comparison of the levels of these particles in their homes as compared to the levels in the city they live. We conducted this in 80 homes across 4 European countries. So it was challenging to recruit participants because it was in a voluntary basis, of course, and we needed motivated people, even people who, after hearing about the levels of particles in their homes, perhaps wanted to quit smoke. So, in average, we detected a 20% reduction in the concentrations of the particulate matter in these houses. So, it is not a big reduction, but this is a challenging reduction, and hopefully it can be increased. This means more or less that we reduce, or they reduce, using the intervention, on average 1 hour of the usual exposure they have in their houses. So
An hour per day? Or?
An hour per day, exactly. So receiving feedback during 30 days. During 30 days, we compare during the days, during this month, the days in which they received the feedback with the previous days in which they were without receiving any type of feedback during the intervention.
So if 1 hour is 20%, the average was about 5 hours of exposure?
Yeah, or even higher, because, well, the distribution was a bit skewed, and in some households, the levels of exposure were quite high. And also, we conducted some qualitative interviews about how the participants feel doing the trial, and most of them reported that they were very happy to know in real time, without delay, not past week you had this level of particles in your house, but no, yesterday or this morning you have had these levels of particles in your home. So this was challenging to them, and it was part of the motivation, and most of them did some progress towards smoke-free homes. That was the final outcome of the intervention.
Yeah, and so there's a little bit of ray of hope after all the high levels of exposures you have been reporting before. And I guess that has an impact, meaning the whole amounts of people exposed, amounts exposed, and in terms of diseases, I guess, both in terms of diseases attributable to second-hand smoke exposure and in terms of mortality attributed to it.
We were able for the first time for Europe to develop this type of calculation of estimation that are a little bit complicated in some ways. And using prevalence of exposure already shown here in the national statistics regarding the main diseases related to second-hand smoke, both in adults and children, we estimated, as you can see here in the slide, the disability adjusted life years, or DALYs. DALYs, the definition is the picture, are the number of years lost due to ill health, disability, or early death. And the burden of disease attributable to second-hand smoke quantifies the number of DALYs that could be avoided by removing exposure to second-hand smoke. So we did this estimation. And
Yeah, go ahead.
going ahead, we first of all decided that disease is causally linked to second-hand smoke exposure. As you can see here, for children there is low birth weight, sudden infant death syndrome, and also low respiratory infection, otitis media, and asthma. Instead, for adults, there are other diseases, of course, and there are ischemic heart disease, chronic obstructive pulmonary disease, the COPD, the stroke, diabetes, asthma, lung cancer, and for women, breast cancer. Looking at this picture, that is the main results for children in 2017, you can see that from children from 0 to 14 years old, exposure at home determined in all Europe about 344 deaths, that are 1.5% of total deaths occurred in 2017 in Europe. And looking at disability adjusted life years, there are about 37,000 DALYs that are about 0.75% of total DALYs. You can see here that there is a wide variability among the European Union countries. For instance, if you look at the bottom, you can see Romania, Slovakia, Poland, and Bulgaria that has the levels more than 1.2% in DALYs attributable to second-hand smoke exposure. Instead, and these estimates are 3 times higher than that observed, for instance, in the top area of the picture. So, for instance, Netherlands, Belgium, and other countries of the northern area, so Finland, Sweden, Estonia, and also the United Kingdom.
Is that reflective of the exposure they have in these countries, the variation? Do you think that is?
We think so, because the main difference in the estimates is the prevalence of exposure. So we are confident that this is an indication of the different exposure in these countries.
And can you put an economic value to this in terms of what is the economic burden of this? Can you provide some results on that?
Okay, we can. This is the slide where we speak about smoke-free home scenario in the sense that we computed for, in this case, only for 5 selected countries, the quality adjusted life years, and put in a scenario of freeing homes of second-hand smoke. We obtained gains in quality adjusted life years. They range from Bulgaria from 50,000 euros to 150,000 euros in Germany. It depends on the number of population here, of course. But also, there is a savings in healthcare costs that are in a range from 40 million euros in Bulgaria and over 200 millions of euros in Germany. But I have one slide more about the adults. It's here, okay. And this is the same results of children, but only look at the adults. And here you can see that in 2017, in adults, about 700,000 dairies are attributable to second-hand smoke. The number for adults are bigger, of course, than for children. And about 30,000 deaths are attributable to second-hand smoke. In Europe, you can see in the middle of the graph, there is about 0.5% of the total deaths occurred in 2017 in Europe. And there is also here a wide variability, not as was measured in children, but it's twice, for instance, in the bottom part of Bulgaria, Romania, Croatia, and also Greece. They have about more than, I don't see very well the number here, but it's 0.8%. And instead, if you look at it, it's 2 times higher than that recorded in the top, and where there is also Germany and other countries, North European countries, Denmark and others.
Very good. And I understand that the team that estimated life years gained and health cost savings in the smoke scenario was led by Professor Robert Nicholas, who is sitting behind. And if later you want to expand, you will be welcome to do that. Let me change gears a little bit here and stop talking about smoke-free, about second-hand smoke exposure, and talk a little bit about the passive exposure to the aerosols of electronic cigarettes. I think that's the exhaled aerosol coming from e-cigarette users after using it, that technically I think you call second-hand aerosol exposure. I understand that there's quite several interesting results, both from the survey and other studies within the project. What did the survey find about e-cigarettes, Dr. Gallos?
Yes, we had an entire section of our questionnaire dedicated to the electronic cigarette use, and we found that in Italy the prevalence of use of electronic cigarette is 2.4% overall. It is similar between men and women, and it ranged between 0.6% in...
That's across Europe, not the whole Europe?
The whole Europe, yes. And it ranged between 0.6% in Spain and 7.2% in Europe, in Italy. And this use exposed non-users to the second-hand aerosol, and in particular 60% of Europeans are daily exposed to second-hand aerosol of electronic cigarettes, and this exposure reflected in a way the use in various countries, and therefore it was relatively low in Spain, 4%, and relatively high in England, 30%.
So to put it in perspective, the 16% of bystanders, that those are non-users, I guess, were exposed to the second-hand aerosol or the exhale aerosol coming from about 2.4% of users. That's a little bit to give us the picture. And
we are talking about daily exposure.
Daily exposure, so it's not occasional.
Exactly.
Okay, that's interesting. And perhaps later we can expand a little bit in comparison in terms of magnitudes of exposure to secondhand smoke and secondhand aerosol. But for now, let me ask you. I guess the question is whether the exposure to secondhand aerosol is harmful or not. And I note from what I read that the composition of secondhand aerosol is a complex aerosol. It's not just water vapor as some claim. Can you expand on that, Dr. Fernandez?
Yes, and I wanted first to clarify that second-hand aerosol is the exhale aerosol by the user of the e-cigarette. This is a bit different from second-hand smoke, that is the mixture of what the smoker exhales plus the side stream of the cigarette. In the case of electronic cigarettes, they are only producing the aerosol when the user inhales. And then, as the previous picture was showing, the cloud of aerosol, not vape, but aerosol, goes to the environment. So this second-hand aerosol has different components. Just a quick look. It has most of liquids used by electronic cigarette users contain nicotine, and the aerosols they exhale do contain nicotine too. So they have nicotine, and not only nicotine, but also tobacco-specific nitrosamines that are derived from nicotine and non-nicotine. So, and they are type 1 carcinogens classified by the International Agency for Research on Cancer. We may find these components in the aerosols and also in biologic fluids of the bystanders exposed. We have found all this information from an extensive literature review conducted within the TackSHS study and also in some of our own studies. Aerosols do contain also VOCs, volatile organic compounds, with formaldehyde, acetaldehyde, benzene, isoprene, and other components that are toxicants. And they have other elements that that they will not been found before, for example, in second-hand smoke, as heavy metals. We may find aluminum, nickel, zinc, and even silver that can pose some problems also to health. So the mixture in aerosols is complex. It's not just water vapor, as claimed for long for the industry, but a complex mixture of these components with also particulate matter that have a direct effect on the pulmonary and other tissues in the human body.
And this is just to give us an idea, if you can, I know it's not part of your study, but how does this compare, these concentrations with tobacco smoke?
Well, this is one of the main comparisons that have been done. Of course, the toxicity and the levels of several of these elements are lower than in second-hand tobacco smoke, but are higher as compared to fresh air. That is what we usually humans prefer to breathe. So they are lower than second-hand smoke concentrations, the different types of particles, but they are even a bit different because we may find also some other components, and there are levels that in fact are not good for health.
And your study has studied what are the effects on the respiratory health systems of the second-hand smoke. I know that Dr. Giorgi has led this work. Can you explain a little bit what did you find?
Yes, of course. In the study, we exposed non-smokers, healthy non-smokers, for 30 minutes to e-cigarette aerosol, second-hand aerosol, emitted by a human user. What we measured was from the pollution, the environmental pollution that was produced, and then we evaluated some exhaled respiratory biomarkers, as the one that you see there. It's the exhaled nitric oxide, which we found that it was reduced post-exposure. And let me say that exhaled nitric oxide is a biomarker of airway inflammation, and it usually increases in inflammatory states such as asthma. The fact that it's reducing post-exposure to SHA, to second-hand aerosol, that's similar to what happens after exposure to second-hand smoke or through active smoking, and the mechanism is probably a negative feedback mechanism, which means that there is an exogenous nitrogen oxide providing source, that is the inhaled mixture, the second-hand aerosol in our case. So you can say what's the implication? The implication is that the nitrogen oxide is used as a marker of to monitor, let's say, asthma, how the disease is going on, to monitor the disease and to monitor the response to treatment. So you can understand that it just makes it can obscure the idea of what the patient has. We might take it as an approach that our patient is improving instead of having another problem. We also measured the lung function mechanics through the impulse oscillometry, and we did find some mild alterations on a parameter that measures, that gives, that's part of the resistance to breathing, shows that there was an uneven ventilation distribution, so something that's making the airways irritated, and it's among the alterations that we may find in patients with asthma or in patients with chronic obstructive pulmonary disease. And the next thing we did was a questionnaire on irritation symptoms. You can see here in the graphs how the symptoms of irritation from several systems, the eyes, nose, throat, and the general symptoms, how they evolved over time, and how they were associated with an increasing concentration of the pollution, and mostly we did the association with the volatile organic compounds that were emitted by the cigarette that was used. So to sum it up, I would like to say that that was a short exposure of only 30 minutes. And we saw that most of the irritation symptoms, they were reversed after 30 minutes in a clean room where we moved our participants. But for the throat and respiratory symptoms, 30 minutes in a clean room were not enough to reverse them, so we still have responses regarding throat irritation, mainly dry throat or sore throat or cough. And so it's easy to think that the implications of longer exposure to a higher concentration exposure would be probably more severe.
Yeah. So if I understand well, you're talking about a situation in which you have a relatively short time of exposure and a low level exposure. You're not talking about longer chronic exposure and higher.
No, it was just 30 minutes. We had a consistent topography for the way that they usually use the cigarette. It was the same for all 40 participants. And we did use some different settings on the electronic cigarette. I mean, we changed two kinds of resistance, and because the initial aim was to compare the settings also, but that was inconclusive. However, the use of the lower resistance that goes with the higher wattage, it was the one that gave the stronger, the more significant results.
Well, you have mentioned it. It was clear that secondhand smoke exposure occurred in the population. We have been able to better characterize it. But I believe that one of the new lights that the project is providing to the scientific knowledge is that we know now that the population reports this exposure to secondhand aerosols
at a population level, we have information from 12 different countries with the range of exposure as perceived by the people. This can be just a subjective impression, but we also have measured the constituents of aerosols and also what is provoking, in this case, in healthy volunteers exposed for limited time. So I believe this is important to advance in the knowledge of the potential hazards of second-hand aerosols and to evaluate this together with other components of the eruption of electronic cigarettes in our lives, because well, they can be claimed to be useful for tobacco control in some cases and so on, but we have to take into account that the use provokes some passive exposure to the second-hand aerosol. So in this case, we are a bit surprised about what we call the relative contribution of electronic cigarette use to second-hand aerosol exposure. We have the figures of people using and people exposed, and we believe that this is important, and also the comparison with tobacco, with combustible tobacco is of importance, as Silvano has also analyzed with the data we have.